guys, welcome to another episode of Hanging Out with Dee. And you know what we do here is hang out with very amazing, inspired people who are masters in their craft. And today we have Dr. Hemant Dhawan with us. He's a pediatric dentist from Dental Associates, and he's going to hang out with us, talk to us about how to keep our kids' teeth clean and all that good stuff. Welcome, Dr. Dhawan.
Thank you for having me.
Yes. So I see that you have a Bachelor of Science cum laude from the University of Florida. And then you have your DMD from the University of Pennsylvania.
Yes.
And that you worked for a couple of years in New York, and then you decided to come to Connecticut or come back.
Correct.
To Connecticut.
Correct. I did my specialty training in New York City.
Yeah.
And then after I completed my education, I was recruited to come and join Dental Associates and never looked back.
Yeah, the rest is history.
The rest is history.
So where did you grow up? Did you grow up here?
I grew up locally.
Really?
I grew up in Connecticut.
Yeah.
And at the right age of 16, we moved down to Florida, where I completed high school, finished college, and then steadily worked my way back north, where I came back to my childhood roots.
Interesting. And so you didn't do high school here, then you did all of that back in Florida?
I did half of my education here
in
Connecticut. I went to the Worcester School in Danbury.
Yes,
and
that's
then
a good school.
It is a great school.
Yeah.
It gave me a lot to build on.
Yeah.
And it made me a very well-rounded student.
Yes.
And helped me balance work and life. So I credit Worcester for many things.
Teaching you a lot. Yeah. So tell me about your amazing family.
Well, I've been fortunate to have, a great mother and father as mentors and parents and now friends. I was fortunate enough to have an older sister who has been unbelievably inspirational and helpful in guiding me.
Yeah.
And I credit her for helping me select part of my profession.
Really?
Yeah.
Did she help you?
She did. In fact,
Really?
ever since I was 5, I knew I was going to be a doctor.
Okay.
The problem was I didn't know what kind.
Yeah.
And I got through college, and I thought I was going to be a physician.
Yeah.
All my parents' friends growing up were physicians or surgeons, so the natural path was go down the medical.
same thing.
Exactly. Yeah. So my sister actually told me one day, she goes, your focus is on talking to your patients, and you're such an extrovert. The way medicine's going, you're going to miss out on that. And she gave me the name and number of a general practitioner in Gainesville, Florida. And she said, if you don't do anything, at least just go ahead and meet him, talk to him, and see how he is with his patients.
Yeah.
She hadn't even met him. She said, I've just heard about him.
Yeah.
After meeting him, he invited me to come back to his practice and to just shadow him, which I felt was the most important thing that I could do as a student, is just observe. And after shadowing him for 3 weeks, I realized that dentistry was such a clear decision for me.
Wow.
Instead of being in a hospital and shuffling between private practice and the hospital, here he was. He and his wife practiced together. They had a brilliant work and life balance. His patients adored him. His staff, his other family essentially, adored him. He loved them all, and he left every day happy.
My goodness.
So it was such an eye-opener.
That was your inspiration for going into dentistry.
So my sister was really the one who I credit for helping me, find that path.
Yeah.
And so my sister's been unbelievably helpful. And of course, I have to give credit to my wife, who I love dearly, and who is my best friend, my sounding board, my partner in crime, and who I come home to and share, the best parts of my day, the worst parts of my day, and everything in between.
Yeah.
She's been an unbelievable addition and support in my life.
So what's her name?
Amita.
Shout out to Amita. That's wonderful. And you're also expecting.
We are. We're expecting a thank you. I would love to say I'm the first person, but it's not true. It's
well, this is your first.
It's our
so
first.
This is exciting.
It is very exciting. So we're expecting in July, and we found out we're having a boy. So we're very, very excited.
Wonderful.
Everything
really
looks
happy
great.
for you.
Thank you.
And I know from firsthand experience how good you are with your patients. Having my son been referred to you after having a bad experience with another dentist. What is it that makes you so patient with dealing with kids who are traumatized?
So children innately want to be happy, right? They want to be supported. They want to feel comfortable.
Yes.
That's not just children, that's people.
Yes.
Okay?
True.
If you can just get down on their level, explain things, and work with them. negotiate almost, okay? You can get them to do what you need them to do, okay? They're meeting me for the first time.
Yes.
And I have to get them to feel comfortable and trust me.
Yeah.
The basis of any relationship is
It's
trust, right?
So you build that
you
with
have
them.
to. You have to build that rapport. If you don't build that rapport,
then you lose.
you're never going to have it. You're never going to get their trust. You're never going to be able to go forward and build a relationship.
You have certainly done that very successfully.
I've been very fortunate.
All right, guys, we're going into Dee's life questions. All right, welcome to Dee's life questions, Dr. Dee.
Thank you.
So, how did you know that you were doing what you were made to do? That you're like in that purpose pocket that you sit so beautifully in?
Well, honestly, it kind of fell into my lap.
Yeah.
Okay, I was fortunate that when I went to UPenn for my dental education, I had phenomenal faculty. I mean, they really helped guide me.
Yeah.
And I was fortunate enough that I had one faculty member who came back and told me, Hemant, you're destined to work with kids.
Yes, that's so true.
And she goes, if you want to specialize in anything and you ask me for a letter of recommendation, I'm not going to write it unless it's for pediatrics. So
she made that clear.
She made it very clear, abundantly clear, that I will not go for, exactly, I will not be going any other way. Right?
Definitely.
And if I did want to go ahead and do another subspecialty, that would be fine, but first I have to do pediatrics.
Yeah.
So I was fortunate enough to have someone push me in that direction.
She was divinely guided because you're certainly doing what you should do.
You know, I've been fortunate to have people who can help guide me down the right path because we can't do it all on our own.
Definitely not. Agreed,
So.
agreed. So, when you become a dad,
Yes.
what values do you want to pass on to your son?
You know, the most important thing that we as adults can teach our children is how to become a better person.
Yeah.
And how to cope with life.
Yeah.
It's not all fun and games.
It's not.
There are going to be things that you have to do that you don't want to do, that are not fun. And I want my kids to learn to be a productive member of society and how to cope with the lemons that life's going to hand them.
Yeah.
Okay?
How to make some lemonade.
Exactly. You know, we've all heard the phrase.
Yes.
But that's truly what it means.
Yes.
So if I can take my child and help them become a better human being, I've done my job.
Yes.
And I want them, of course, to be well-rounded. I want them to be athletic and to appreciate every aspect of life.
Yeah.
But I want them also to cope with the harder aspects of life.
That's good stuff.
I think so.
Because it is coming.
It is.
It's about how prepared we are, you know, for them when they're coming. What is success for you?
Success is the ability for me to go home after a day,
Yes.
put my head down, close my eyes, and sleep soundly, knowing that I've done my level best. Okay?
I love that.
It's nothing's going to be perfect. Okay? No matter how hard we train, how hard we work, how much we study, how much we prepare.
Yeah.
Life has a way of twisting things on us, right?
Correct.
And if I can go ahead and say, you know, I gave it my all.
Yes.
I've made somebody's life out there a little bit better.
Yes.
I've done my job.
Yes.
You know, I've taken that child who was fearful and nervous and had a bad experience, and
you've turned it around for good.
Exactly.
Awesome. Guess what, guys? Things are moving so fast and we're having so much fun, but it's time for Say What? All right, so we're going to go into some slides now. We're going to talk with Dr. Dee about what is pediatric dentistry. What's the difference?
So pediatric dentists are specialists.
Yeah.
Okay? Just like you take your child to see a pediatrician, you should be taking your kids to see a pediatric dentist for a few reasons, actually.
Okay.
Pediatric dentists not only completed dental school, but then they did a subspecialty in pediatrics. That's an additional 2 to 3 years.
Oh, wow. Okay.
So it's not that they just did a course or did a continuing medical education class and found out how to
go again for another 2 to 3 years
Correct.
to be
So
certified.
just like medical school is 4 years, so is dental school.
Yeah.
Then residency. So by the time we come out, we've been trained in behavior, psychology, how to deal with the surgical cases, pharmacodynamics. So there's so many other things that have to go into being a specialist than being just a family dentist.
I got it.
Okay,
Got
so that's why you want to take your kids to a pediatric dentist, because they fundamentally understand the difference and how to treat the child as a whole versus treating a tooth.
Got it.
Okay.
So it's more than the tooth, it's a person.
Exactly.
I got that.
A dentist shouldn't just be treating a tooth, they're treating a person. That
So
tooth
good.
doesn't walk in, the child
So
walks
good,
in.
so good, so good.
So that's the main difference.
This is going to be a clip that I'm going to replay over and over again. I like that.
I'm glad.
Beautiful. Why brush baby teeth? And you have a little friend
I
here
have,
who's
this is
gonna
Allie
show
the
us.
alligator.
Yes.
And, you know, we hear this often. What's the point? Baby teeth or primary teeth or milk teeth, they're going to fall out.
Yeah.
Why
Why
brush them?
Yeah.
The reality is that they're eventually going to fall out, but they may not fall out the way we want them to, or they may fall out too early, and we don't want our kids to end up with cavities.
Correct.
Okay? So by keeping the baby teeth healthy, what we're doing is we're creating good habits for our kids. We're preventing disease, infection from spreading.
Correct.
And we're keeping the bacterial count low.
Yes.
Okay? So it's all about establishing good habits and keeping our kids healthy.
Okay.
That's really the fundamental reason for it.
All right. Do kids still get cavities?
Absolutely. The problem is that it's been on the rise for several years. In fact, according to the CDC, 2014 was the first year where we did not see a rise.
Really?
Yes. Cavities are still very much a reality this day and age. The problem is that, you know, with the kids, it's all about not just hygiene, not just about genetics, it's also about the foods that they're eating.
Correct.
Okay?
Which we'll talk about later.
Of course. And you know, the best time to catch a cavity is before it starts.
happens.
Exactly. Prevention, right? That's what it's all about. So if you're doing the basic things, you're helping them brush twice a day, you're helping them floss.
Correct.
You're taking them every 6 months, not just for a checkup, but they're cleaning,
Yeah.
fluoride treatment, and their annual x-rays, which are recommended by the time the child is 4.5 to 5 years old, depending on what teeth they have. You're going to be that much further ahead.
Ahead of the game.
Exactly.
All right. So do you want to show us how to do the brushing?
Absolutely. So I'm going to have Allie sit on my lap,
Okay.
and we're going to get a toothbrush. So for those mom and dads out there that are watching, I know you don't have the luxury of putting your hand
Behind your child's
behind your child's
into
mouth
their head.
and getting them to open this wide, but in a perfect world, you would be able to. So you, of course, would put a pea-sized amount of toothpaste on the brush.
Deep.
Perfect. The child will open nice and wide. And in small circles, you would just go ahead and brush up and down and all around, left, right, inside, outside, back and forth.
So not straight up, you're saying?
No.
Brush in circles.
So what we see most kids do is this.
Correct.
Spit, and that's
Yes.
it. And then they
That's not
smile. Their breath smells minty fresh and bubblegummy, but they haven't received any attention in the back. So not just the eating surfaces, but the sides. The gums need to be stimulated. That's truly the only way we can get the plaque that's developing up here
So we're supposed to be brushing from the gum down,
down,
not just the
small
teeth.
circles.
Okay.
Okay? That's the ideal way to go about doing it. And then, of course, every child's favorite activity, of course, is flossing.
Not.
So, exactly. So, of course, my recommendation, and this is for teaching purposes, is to go ahead and get a piece of floss like this. If you can get the little handheld sticks, that'll make your life even easier.
Okay.
You have the child lay back with their head in your lap. Thank you. And then you're just going to gently go between the teeth. Just like that. Okay? And you'll pop it out. So the idea is that you want to get between all the way down so that the kids get the food out that are stuck between their teeth.
Got it.
Most of the times children say, oh, but I don't feel anything. Well, that's good. They don't feel it, but the problem is it's still there.
Correct.
So the idea is that the more we help them, the better their hygiene will be, the less chance for cavities, the less problems, and the healthier they're going to be.
Wonderful.
So thank you, Allie.
Thank you, Allie. Why do kids need x-rays? I know this is another question that you find in your practice. Why do kids need x-rays?
So x-rays have been proven to help us diagnose. They're one of the many tools that we use to help find cavities or find pathology.
Okay.
The idea is that in this day and age where technology is our best friend, we're able to find decay, find cavities earlier.
Early on.
Yes. And going back to the idea of prevention, the earlier we find it, the easier we can fix the problem.
Yeah.
So children should be getting x-rays once a year on average, Okay. Unless there's trauma and extenuating, extraneous circumstances.
Yeah.
But for the vast majority of our patients, once a year, for their just regular checkup x-rays is good enough. And that's going to help us.
Correct.
And then when the kids are about the age of 7, we want to do what's called a panoramic x-ray.
Correct.
Okay, it's the x-ray that goes around the head.
Right around, yes.
Yes. And it helps show us not only development, but the adult teeth that are growing, any pathology.
So when you say the word pathology, explain to our
Cysts.
viewers. So anything.
Tumors.
Yeah.
Anything that's abnormal.
Do you find tumors in children?
We have. We find extra teeth. We find that some kids are missing teeth that they're supposed to have.
Okay.
We find that some children have small tumors that can become problematic.
Wow.
Okay, so the earlier we're able to identify the problem and remove that source, the better off.
Got it.
So the idea is that if we can see something in the bone, we'll be able to address it earlier.
Correct.
And make it easier for the child.
Understood.
That's the idea.
And what about braces?
So, braces. Every child by the age of 7 should have an orthodontic evaluation. Okay. So we'll see the child's bite. We'll assess not only just the teeth, but the way the teeth are fitting together and the bone. And once we determine whether they need some intervention, the earlier we get started, the easier it is. When we were growing up, it was waited for all your baby teeth to fall out, and then you got braces. And some kids had them for 3, 4 years.
Yes.
The idea, we've moved away from that. One, braces that were on for the teeth for too long would cause problems. More kids were ending up with cavities.
Really?
Right? Oh yeah, because they were unable to clean the teeth properly. So the food, the plaque, the bacteria is just sitting there and festering on the teeth, causing cavities. This way, if we go ahead and do early treatment around the age of 7, 8, 9, it's a shorter duration. Then we've already made enough room in their mouth. We wait until more teeth come in, and then we straighten everything.
Smart.
It is. And this way we're losing, we're not taking out more adult teeth like we used to.
Okay.
We're saving them. We're keeping the kids happier and healthier. And it's a win-win.
Wonderful.
Yeah.
So is it something that all dentists are doing, or is it something that you are doing in your practice?
It's something we definitely do in our practice. Every practitioner practices according to how they were taught.
Yeah.
And how up-to-date they are with
what's going on.
Yeah, with what's going on in the world.
Yeah.
So in our practice, we try to stay on top and ahead of the curve.
Yeah.
We've been doing so for the last 20 plus years. We haven't done silver fillings in our practice because there's better materials out there.
Terrible.
But there's still a lot of practices that do it.
I know.
And the material as a whole was wonderful 100 plus years ago when there was nothing else.
I love
but now there's, better things.
Yes.
Similarly with orthodontics.
Yes.
Similarly with pediatrics.
Yes.
There's better materials out there. There's better
Things
treatment modality.
Yeah.
Why not stay current and stay on top of things?
Correct. I had a feeling that I needed to do, and I went to this dentist, local dentist. Let's not call his name.
Okay.
And I went in there saying, so we understand that we're doing white fillings. This is where the world is going.
Right.
And this is what is normal.
Right.
He says, yes, Dee. And when he was done, there was silver fillings in my mouth.
Ooh.
I thought I was going to die. I was like, take them out right now, man. All the Jamaican came out. I was like, what the hell, man? But yeah, and he was saying pretty much that's all he had in his facility. And I'm like, what about all the stuff that is leaching out into your body, all the chemicals or whatever from the metal? And I changed him and had it removed. And,
right.
But yeah, scary. And I'm glad that you guys are doing, thinking of your patient first, treating the patient, not the tooth. That's certainly something.
That's our philosophy.
Yeah.
Okay. We will only do what we do to our own family, to our patients, right? Correct. So we believe that if we do what's right for our patients,
then you'll be
everything will be good.
All right, guys. Now we're going to show you how to prepare foods that are good for your teeth. It's time for Dee's Eats. Hey guys, welcome to Dee's Eats, and today we want to talk to you about what are those teeth healthy foods, what foods are good for your teeth. So Dr. D is going to start off with celery.
So most raw, fresh fruits, vegetables are fantastic because they're fibrous in nature and they help clean the teeth. It requires chewing, right? So as you're chewing, you're actually going ahead and building a lot of saliva. So that's diluting the bacteria count. it's cleaning the teeth, and any food or bacteria that's on the teeth and plaque
will be removed.
Oh yeah, it's going to come right off. So, and since celery is a particular great fruit because it breaks down the fibrous strands, kind of like naturally flossing your teeth.
Correct. Okay, that's pretty cool.
So.
And we have that today, so we're going to make something cool and show you guys how to do that. Next is cheese.
Yes. Who doesn't like cheese?
Everybody likes
Everyone
cheese.
likes cheese. So cheese is great because a couple of reasons. One, it's low in sugar, and two, it's full of calcium, right? So calcium, we all hear, is good for your bones, good for your teeth, good for your nails. It also has something really important. It's a type of protein in cheese and dairy called casein. And casein has actually been shown to help remineralize tooth structure. So the beautiful thing about it is we find it actually in certain dental products. MI paste, which is what we prescribe to our patients who need a little extra help to make their teeth strong again.
Okay, cool.
So that's the great thing about it.
Nice. And we could make a really nice cheese dip.
Exactly.
Organic chips, whatever you want to do, and you'll be helping your kids' teeth.
Exactly.
All right, what's the other one we have?
So next one we have are pears.
Pears.
Fresh fruits.
I got pears here. I'll show you how to do that later. Let's tell us about pears.
Just like the celery, right?
Yeah.
Fresh pears are fibrous, so they help keep your teeth nice and clean. They stimulate salivatory function, and pears are naturally good food because in 2004 it was found that they had a large acid neutralizing effect.
Yeah.
So
and they're saying it's better than even bananas.
Yes,
they were
better
saying
than apples, better than bananas. So
wow, pears.
That's one of the reasons we really like pears.
All right, sesame oil is the other one.
Sesame oil, something that we've heard a lot about is pulling. Have you heard of this?
No.
Okay, so there's some talk about coconut oil and sesame oil, and when you swish it around your mouth, it actually pulls the bacteria out.
Are you serious?
So there's these great added benefits to it.
Wow.
So we have a way of naturally removing the bacteria.
So is the recommendation adding it to your food or using it for pulling, like swishing it? Or,
They're talking about both, actually. Yeah. So if you go ahead and gargle with the sesame oil, it's going to help pull the bacteria out.
That is incredible.
So that's the beauty of it. So it's been shown to be as effective as some of the rinses that we prescribe. It helps reduce general inflammation, gingivitis, helps remove the plaque. So it's had a lot of positive effects.
Wonderful. Next one, we're going to unsweetened gum.
Yes.
I didn't know this one.
Okay, so you always hear dentists say sugar-free, sugar-free, sugar-free. That's what we tell all the time. The reason why we're talking about sugar-free gum versus sugar gum is obvious.
We know the obvious reason, yes.
There are
cavities.
there's sugar-free gums that have a certain type of sugar called xylitol. It's been clinically proven to help reduce cavities by killing the bacteria that causes cavities.
Wow.
So while it's sweet in nature, it has this great added benefit. It also helps you with salivatory function, salivating, so that it reduces the bacterial count while killing them, and also pulls the food off of your teeth.
That is incredible.
So
eat more gum, guys.
Yes.
Number 6, water.
Water. Everyone needs to drink more water. One of the biggest problems we have as a country as a whole is that we don't drink enough water. In fact, we get most of our hydration through our foods, which is why we're having another epidemic, an obesity. So water, especially if you have fluoridated tap water, is the absolute best. We have had a public health initiative in this country for decades, and it's been functioning at optimal levels, helping us refluoridate our teeth and getting them stronger.
Yeah.
So natural tap water is your best friend. Keeps
because
you hydrated,
of the fluorine,
has the fluoride in it, it helps keep you full, right? Reduces bad breath, it helps get the bacteria off. So many added benefits with just water.
Amazing. And yogurt, last of all.
Yes, so just like the cheese, yogurt's another wonderful food. Right. It also has that same protein, casein. It helps go ahead and make your bones strong, your teeth strong. It has calcium and phosphates, and those are both been proven to help remineralize teeth.
Yeah.
So these are 7 great foods for us.
Definitely. So celery, cheese, pears, sesame oil, unsweetened gum, yogurt, water. Guys, don't forget, this is a really good list. All right, so what am I going to do for you now? Now I'm gonna prepare you a quick little snack item that you can use with your family. Yogurt. Mix that up. Got another one here. Mix it up really nice. This one has grapes in it, but you could use obviously whatever you wanted. Okay. Then we're going to add all the cool things that Dr. Dhawan just told us about. Celery. We're going to use the yogurt as a dip. We got our pears. And we've got our very yummy strawberries, guys. So this is definitely something your kids would enjoy, right? It's delicious, it's yummy, and it's also something that you can have your kids do along with you. Have them use not a real knife, but a butter knife and help you cut up the stuff. And here it is. Hopefully you can see it. All right. Now we're going to go to a wonderful music video by our own Dave King here at Channel 23. It's a Danbury song.
There's a harvest moon over the fairgrounds tonight. The rides are all spinning to the children's delight. The midway is crowded with people everywhere. The smell of sausage and peppers is filling the air. Kids are feeding animals in the petting zoo. There's a big crowd gathered round the oxen pull too. There's some bruskies are playing polkas up on the bandstand. Won't you come out and join me and take my hand? You've been getting up early and working late. I know that you're tired, but I just can't wait. I got me 2 tickets and money to spare. Won't you come down and meet me at Danbury Fair? Show in the big top is well underway. John Leahy just finished leading the parade. The cowboys are shooting up the Wild West show. Paul Bunyan's looking down on the masses below. Main Street, New England is busy for sure. Folks are buying some goodies at the country store. The windmill is turning in the Dutch Village sky. Joey Chitwood and his drivers are having a hell of a ride. So put on your sweater and your walking shoes and hurry on over, there's no time to lose. I got me 2 tickets and money to spare. Won't you come down and meet me at Danbury Fair? Come on and meet me at the fair. Whoa, whoa, whoa. Here comes Cinderella in her pumpkin coach, and the governor's making speeches, he's looking for votes. We'll get us some popcorn and cotton candy too, and I'll win you a prize from the shooting range booth. The cars are warming up on the race arena track. The grandstand is packed from the front to the back. It's an annual tradition since the year of my birth. These are the happiest fairgrounds on the face of this earth. So drop what you're doing and don't be late. I'm dying to see you and I just can't wait. I got me 2 tickets and money to spare. Won't you come down and meet me at Danbury Fair?